You mentioned about, bone removal.
Mhm.
How much needs to be, how do you know how much needs to be removed to get that desired vertical?
Yeah, generally it's going to be somewhere between 11 to 15 millimeters per arch to get that reduction that you need, generally speaking. One way that the clinician can know that they're getting the proper bone reduction is a good lab is going to go ahead and make a duplicate denture or a immediate denture, and that the flange is going to be designed differently. It's going to be designed straight across, and it'll be designed at the proper thickness that end prosthetic should be. And so they can put that in the mouth, and this is during the surgery steps, and they can take a carbide or a diamond burr, and they'll go ahead and they'll trace into the bone or into the tissue a line right across where that measurement needs to be. And then as they're reducing the bone, they get down that level, and then they know that they're at the proper level to get that thickness of zirconia and have that bone reduced. Another way would be some labs will provide an acrylic jig that can be placed over the ridge, and it's kind of like a reduction coping, and the clinicians will know what that is, and they can just prep the bone off even with that to get to that area. But getting that's probably the biggest challenge we have. It's probably the number one thing is bone reduction. All fours have become very popular, but they require a certain approach to deliver a good product that's hygienic and that's strong. And so you got to have that bone reduction in order to handle that. And it's more difficult to do on the maxilla than it is on the mandible. The maxilla, you have to reduce enough so when that person's in a broad smile, that they don't see the edge of the zirconia right there.
Yeah.
So as you're reducing that bone, you got to go up enough so that in the broad smile, you don't see that finish line. And that all comes down to pre-planning and knowing all of those things before you even start the case. So you have it done correct when the patient's there, and you get it done in one time. So that's probably where I see the biggest challenge is bone reduction. There are products. We do a product that's all milled out of chrome, and individual teeth are put on preps. And what that does is it allows us to make the prosthetic very thin and narrow. All right, because it's chrome, it's not zirconia, so the strength is there. And that helps you cheat a little bit where you don't end up having a concave underneath the ridge, because it's so narrow that you can get rid of some of that concavity. But now you're talking about real expense. It's really high end when you're making all that chrome framework and individual crowns to put on there. But we do them, and it's a method to get away from that, having an area that's not hygienic, and maybe you don't have the correct vertical you want.